Thank you. And thank you everyone for joining us today. Before we begin, I want to acknowledge that we are gathered on the unceded traditional territories of the Anishinaabe Algonquin Nation. And I would like to take a moment to reflect on the history of Indigenous people and to honor the original stewards of the lands where we work and where we live. So since the last technical briefing, the Andes Hantavirus outbreak associated with the MV Hondius has continued to evolve, and I'm pleased to provide you with an update today. At the outset, I want to be clear with Canadians, the overall risk to the general population in connection with the Andes Hantavirus event remains low at this time. But given the severity of the symptoms of the virus, we are taking a precautionary approach to ensure that Canadians are protected. On May the 10th, 4 Canadian passengers on the MV Hondius returned to British Columbia. Throughout their journey and upon their arrival, public health precautions and health assessments took place. The individuals were transferred to dedicated prearranged lodgings to complete their self-isolation. All 4 remain asymptomatic and are being actively monitored and supported by local public health authorities. La réponse à cette éclosion et le rapatriement des passagers du navire ont nécessité un travail d'organisation considérable ainsi qu'une collaboration internationale et nationale. Je tiens à remercier mes homologues des provinces et des territoires, en particulier les partenaires de la santé publique de la Colombie-Britannique, pour le soutien apporté à ces 4 personnes pendant leur isolement. Nous tenons également à remercier l'Ontario, l'Alberta et le Québec pour leur contribution en tant que partenaires clés dans le cadre de cette initiative nationale. Nous apprécions les efforts rapides déployés par nos partenaires fédéraux, à Affaires mondiales Canada, aux Forces armées canadiennes, à Transport Canada et à l'Agence des services frontaliers du Canada et la collaboration de nos partenaires internationaux, en particulier le gouvernement de l'Espagne et l'Organisation mondiale de la santé. We have adapted the WHO guidance for public health management of contacts to the Canadian context and are sharing it and working on it alongside our provincial and territorial public health partners. While risk assessments conducted on the ship identified all Canadians as low risk, we have taken a precautionary approach here in Canada, and we are considering all passengers and crew from the MV Hondius to be high-risk contacts, as well as passengers who sat close to one of the cases with hantavirus who was on a flight until local public health can complete their own risk assessments. In addition to the 4 passengers who returned on May 10th, there are 5 other high-risk contacts within Canada who are considered as having been potentially exposed to a confirmed case of Andes Hantavirus. This includes 2 individuals who were aboard the ship but disembarked before the outbreak was first identified and who were also on a flight where they may have been potentially exposed to a confirmed case, and 3 other individuals who were potentially exposed to a confirmed Andes Hantavirus case on a flight. These 5 individuals remain asymptomatic and are being monitored and supported by local public health authorities. Vendredi dernier, j'ai fait mention d'une autre personne au Canada qui, à ce moment-là, semblait avoir été potentiellement exposée lors d'un vol. Toutefois, d'après l'évaluation des autorités sanitaires locales, cette personne n'est plus considérée comme un contact à haut risque. Au Canada, on entend par contact à faible risque les personnes qui ont voyagé sur le même vol qu'un cas d'infection par la hantavirus Inde, mais qui n'ont pas eu de contact direct ou prolongé avec cette personne. So we were also notified of an additional 26 travelers who were on the flights but deemed by local European public health as being no risk. Again, in Canada, we are taking a precautionary approach, and we have deemed them to be minimal or low risk as opposed to no risk. The provinces and territories, therefore, are undertaking the work to contact these 26 individuals and provide them with information and monitor them throughout this time. As the situation continues to evolve, the number of individuals for public health follow-up in Canada related to the outbreak of Andes Hantavirus may change over time, and our response will evolve accordingly. Provincial and local public health authorities continue to do in-depth risk assessments, and the final self-isolation duration may be adjusted as we learn more about the risks involved. I would also like to flag that we do not have any evidence that shows that the virus can spread from asymptomatic people, and so there is no reason for us to be concerned about contacts of contacts at this time. So our concern rests with individuals who were exposed to a confirmed or probable case of hantavirus, not those who were contacts of contacts to the virus. All of this has been discussed with my counterparts in the provinces and territories, and we are working hard to align our approaches and will continue active dialogue to support our collective response. Any contact who displays symptoms will be tested. FACT's National Microbiology Laboratory stands ready to provide testing and has been collaborating through the Canadian Public Health Laboratory Network to provide testing capacity and support to provinces. If cases are identified in Canada, FACT has already worked with provinces and territories to identify healthcare facilities that have the capability to manage hantavirus cases. En plus de surveiller les contacts au Canada, le gouvernement du Canada travaille également en étroite collaboration avec les autorités de santé publique, les transporteurs aériens et les agents frontaliers pour mettre en œuvre des mesures de précaution visant à empêcher tout passager ou membre d'équipage ayant été à bord du MV Ondius depuis son départ d'Argentine le 1er avril d'embarquer sur un vol à destination du Canada. Ces mesures resteront en vigueur jusqu'à que la période d'isolement de 42 jours recommandée par l'OMS soit écoulée et permettra de réduire le risque d'introduction d'antivirus Inde au Canada. Cette éclosion souligne l'importance vitale de maintenir des liens internationaux solides. La semaine prochaine, la 79e Assemblée mondiale de la santé se tiendra à Genève. Ce sera l'occasion pour moi, la ministre de la Santé et d'autres délégués de réaffirmer l'engagement du Canada en faveur d'un leadership mondial fort et d'une collaboration sur les priorités en matière de santé. Pendant mon séjour à Genève, je discuterai de la question du antivirus avec mes homologues de l'OMS et je continuerai à participer à la lutte contre l'antivirus ici au Canada, mais je serai secondée au Canada par la Dr Natasha Crowcroft en tant qu'administratrice en chef de la santé publique par intérim. Des cas de transmission interhumaine de antivirus Inde ont été signalés, mais ils sont rares et nécessitent généralement un contact étroit et prolongé avec une personne malade. De plus, l'antivirus Inde est très différent de la COVID. Mais comme le souvenir de la pandémie de COVID est encore très présent, il est compréhensible que de nombreux Canadiens se sentent inquiets à ce sujet. Je tiens donc à préciser que tant l'Agence de la santé publique du Canada que les autorités sanitaires du monde entier s'accordent à dire que l'antivirus n'est pas considéré comme présentant un risque de pandémie. Compte tenu de la période d'incubation du antivirus Inde, qui varie de 1 à 6 semaines, des cas d'incubation pouvant aller jusqu'à 8 semaines ayant été signalés, il est possible que d'autres cas apparaissent, en particulier liés à des expositions survenues avant la mise en place des mesures de confinement. In closing, I want to reiterate that we have robust processes and procedures in place, and further spread of the virus within Canada is not expected. But we are taking the situation and our commitment to supporting the health of Canadians both here and abroad very seriously. We will continue to provide updates on the measures being taken to protect the health of people in Canada. And again, I want to send out my sincere thank you to my provincial and territorial colleagues, as well as our federal and international partners for their continued support and collaboration. Thank you. Merci, miigwech.
Thank you very much. I was remiss in not introducing the rest of the panel. We have with us also today Sebastien Beaulieu, who's the Director General, Emergency Management at Global Affairs Canada, and Martin Gaudet, who is the Acting Executive Director, Program Development, Civil Aviation, Transport Canada. When we get to the question and answer, gentlemen, if you're answering a question, I'd ask you introduce yourself because some of our participants are listening and not watching online. With that, if colleagues online, if you have a question, please use the raised hand function on Zoom. But as mentioned, we'll begin in the room with Craig Lord from the Canadian Press.
Hello, Craig Lord, Canadian Press. You mentioned earlier the need to align the approach with provinces and territories. Coming into this briefing, I believe in Quebec, we had 8 individuals who may have been exposed who were not isolating unless they were showing symptoms, while as Ontario, people who may have come into contact with someone who had hantavirus were instructed to self-isolate for 45 days. What should Canadians make of inconsistent guidance like that across the provinces when inconsistent guidance was something cited as breeding distrust during the COVID-19 pandemic?
Thank you. I think that's a really important question. So we have 2 categories of contacts in general right now. We have the who we're calling high risk, but asking local public health to do thorough risk assessments to determine if they should stay high risk. And then we have the group who were reported to us as no risk, but we've decided to call them low or minimal risk. So the individuals who are not being directed to isolate would be in the low or no risk across the board in all provinces and territories. All of the individuals who have been determined to be high risk are being given information about self-isolation and are being monitored as well, regardless of which province they're in.
Another question kind of related to this whole situation going on. We have cruise ships becoming kind of an incubation site for not just hantavirus, but there's a norovirus outbreak as well in the world right now. Given these kinds of conditions, for example, would you go on a cruise right now?
Yeah, anytime people are making decisions, we want them to be aware of all of the risks and benefits of those actions. And any activity that includes close, prolonged contact with multiple people will always carry the risk that infectious disease can be spread in those settings. So it's not unique to cruises, but cruises is a setting where there is close and prolonged contact amongst passengers. And so it's important that we are providing information to Canadians to make informed decisions about the risks of choosing to go on cruises or any other activity that might put them in close, prolonged contact with large groups of people.
We're now going to move online for questions. We'll begin with Lauren Pelly from CBC News.
Hi, good morning. We just wanted a bit more clarity on the count of Canadians who are isolating in different forms. So you mentioned there's 26 new individuals that you're currently contacting. Can you walk us through a bit more on that process and where those Canadians are based across the country?
Yeah, so in my original introduction, I mentioned that we were notified of 26 individuals that were on flights that a case was on, but were not considered to be contacts because of where they were located in the flight, and they did not have any interactions with the case. So those 26 were reported to us from European authorities as being no risk. We've decided to take a precautionary approach and instead consider them to be low or minimal risk. And so they are in various places across the country, but local public health is working to get in contact with all 26 of those individuals to ensure that they are aware that they were on that flight, that they have information about what symptoms they need to be watching for, and that they're being monitored throughout the at-risk period. So this is something that is consistently happening across the country, that provinces and territories are doing that work of getting in contact with the low or minimal risk individuals who were on flights but not actually deemed to have been in contact with the case.
And when did this occur? When did the European officials reach out with this information?
We've gotten information from them on a few different instances. There was more than one flight of concern, and then additionally, because the information originally came to us as far as individuals who had a final destination of Canada, there we've done further analysis and found that there are individuals who subsequently also came to Canada despite not originally being identified there. So there's been several different notifications over time, and every time we receive that, we the same day are contacting our provincial and territorial partners to start that process of reaching out to the individuals.
And just to clarify, what is the current tally of Canadians then who are isolating across the country, along with this additional 26 people that you're now contacting?
So there are 9 individuals who were considered, at least at present, are considered to be high risk and have been given direction to self-isolate across the country. There are an additional 27, so the 26 I mentioned, plus the one individual who was originally high risk but got assessed down to low risk. So 27 individuals across the country who are being contacted by public health but not directed to self-isolate.
We'll move along to Heidi Petracek. Sorry if I pronounced your name wrong, from Global National.
Nope, that was very well done. Thank you. I did want to ask about the restricting passengers and crew from the MV Hondius from coming into Canada. Can you explain more about how that process works? I mean, I know they've been told not to travel, but do they get stopped, before they get on a flight to Canada or in Canada, or, how would that actually work?
This is Martin Gaudet from Transport Canada responding. You're right. Working in collaboration with public health authorities, air carriers, and border officials, the Government of Canada issued temporary measures in respect to certain flight operations in accordance with World Health Organization guidelines. So based on those temporary measures, which apply to passengers and crew that were on the MV Hondius during the time of the outbreak, those individuals will not be able to board any commercial flights to Canada. And that will be enforced for the 42-day isolation period recommended by the Public Health Agency. And we'll be working closely with the Public Health Agency of Canada, the air carriers, and border officials as well to ensure those measures are implemented effectively and consistently.
Just a follow-up question to that, if I may. When you're counting the duration of that temporary measure, what are you dating it back to?
The temporary measures will cease to have effect on June 17th.
Okay.
Next up, we'll go with Sarah Ritchie, the Canadian Press.
Good morning, Dr. Reimer. I'm hoping you can talk to us on World Vaccine Day about a new poll that we reported this morning that about 1 in 4 Canadians say they've declined to take a vaccine that was recommended to them by their doctor. I guess I'm curious how concerned you are by that figure, and if you can help us understand what the Public Health Agency of Canada is going to do to try to tackle vaccine hesitancy writ large.
Vaccines are one of the most successful medical inventions we've ever had. They have saved millions of lives around the world, and remain one of the strongest tools that we have in our toolbox to prevent illness around the world. And so when I hear that people are concerned or choosing not to follow the guidance of their physician in getting a vaccine, we're obviously concerned about the outcomes of that. That said, I also know that people are often bombarded with misinformation, and it can be very difficult for them to find their way through that to figure out what the truth is and what the best advice for them is. And I know that individuals are making the best decisions that they can for themselves, for their families. Nobody's trying to make a decision that they believe will be harmful. And so it's important that we look at this with a lot of empathy, because people are really struggling, trying to make their best decisions. A lot of them also have problems with access to care. We know that there are millions of Canadians who don't have a family doctor. And so this adds an additional barrier for people being able to get preventative care like vaccines. So we're going to be working at the Public Health Agency of Canada alongside with partners leaders in provinces and territories, non-governmental organizations, making sure that we are putting out accurate, reliable, trustworthy information, but that we're also arming the individuals on the ground who have that trusted relationship with individuals with the information that they need to be able to help people on the ground make those decisions. Because I know that while it's important that I, at the federal level, am putting out useful, trustworthy, accurate, evidence-based information, it's even more important that the people who have that trusted relationship have those tools, because we know that people listen to those people in their lives that they trust, care about their well-being. So we're going to be partnering all the way from the front line, from family, religious leaders, community leaders, all the way up to the national level to make sure that our messages are consistent.
And as a follow-up, do you feel that you have enough information at the federal level right now about who is vaccine hesitant in this country and why, to be able to tailor your messaging accurately?
We do have good information from various surveys over the years, and I know that we also often hear the term anti-vaxxers, and I think that that's a term that applies to a very tiny group of people. Most people who are not caught up on their vaccines, it's not because they are against vaccines. They may have some hesitancy, or they may just have competing priorities in their life when they're dealing with other things that are making things complex and difficult, trying to take care of their kids, go to work, take care of aging parents who might be ill. These things pile up, and so we need to make sure that we're using all of this information to help people make healthy decisions, make those healthy decisions the easiest decision for them, and arm everybody who's going to be looked to as a source of information in their lives with that accurate, trustworthy, evidence-based information.
Thank you. Next up, we'll go to Tashana Reid from CBC.
Good morning. Thanks for taking our questions. I just wanted a bit more clarity on the low-risk approach versus high-risk individuals. We had learned yesterday that the public health in Ontario had advised people who were low risk to isolate as well as high-risk individuals, but we saw in Quebec that that was not the case. So I just want clarity on why there is the difference between some provinces.
Yeah, thank you for that question. So we are working together with all the provinces and territories, and we're creating national guidance on what we anticipate the minimum should be. And so we're putting forward guidance about what we expect to see as far as what the high-risk folks are directed to. And at this point, the 9 until further risk assessment is completed are considered high risk. For low-risk individuals, we anticipate some of them, even unrelated to hantavirus, will have some symptoms of a cold or something else, and may have to begin isolation if they have even unrelated symptoms while awaiting testing results. Or there might be individual circumstances that they are talking to local public health about that might make local public health more concerned than the original information that came from our European counterparts. So that's the critical part of how we work in this country, is the ability for us to have national guidance, national consensus, but also to tailor to the information that is unique to each individual in this circumstance. And that's where the work of local public health is critical, so that they can respond to the individual circumstances in their community when they might need to increase the surveillance or increase the guidance that is being offered to those individuals.
I just had one additional question around testing. I know you've just said that you will not be testing any asymptomatic individuals, but we are seeing a number of other countries with repatriated citizens doing testing. So just curious, will you test any of the identified contacts at any point, even if they are not symptomatic?
It's a great question, because it's one that everybody around the world is struggling with, because the tests for hantavirus in asymptomatic people, the literature is not as well established as it is for many other more common infections. So we are bringing together an expert group to help inform us and give us some guidance on testing. At this point, we know that if anyone becomes symptomatic, we will absolutely be offering testing to those individuals. We may offer testing to to asymptomatic people if, based on the information we gather from our international partners, from our expert group here on the ground, demonstrates that the benefits of the testing would outweigh the risks. And the risks that I see, the biggest risk, is the false reassurance that a negative result can provide. If somebody is perhaps testing negative but later could go on to develop hantavirus, I don't want that individual to be taking their isolation requirements less seriously. So that's the balance that we're trying to strike in getting as much information as we can and is useful without giving people a false reassurance that might lead to unnecessary exposures.
Great. Thank you so much.
We will go next to Nicole Ireland with the Canadian Press.
Hi, sorry about that. Can you hear me?
Yep, go ahead.
Thanks so much. Thanks for taking my question. I just want to follow up on my colleague from CBC, Lauren Pelly's question earlier on these 26 Canadians. So are they being asked to, they've been deemed low risk, are they being asked to isolate? And in which provinces are they located?
So I don't have the exact information available that I can provide to you right now on where each individual is across the country. What we know we have done is provided all of the information that we have to the provinces and territories for them to be able to work on contacting those individuals. As a broad statement, the low-risk individuals are not being required to self-isolate. However, local public health may make determinations based on their individual circumstances, and they have the ability to recommend isolation, even if, as a global category in Canada, we're not recommending that, because they do have that additional risk assessment ability because of the work that they do once they contact those individuals and collect that information.
Okay, and as a follow-up, I understand that, so it was European agencies, et cetera, who provided you with information about these folks. So were these 26 all people who were on flights and were determined no risk because they weren't sitting near a known contact? Is this all flight related?
That is correct. The 26 were all on flights, but were not sitting near, nor had any evidence that they came into any contact with the case that was on the flight.
Thank you.
Two of the folks who've already asked questions, I still see your hand up online. We have a few more minutes, so I'm happy to go to you again, but just lower your hand if you don't have another question, and we will go back to Heidi with Global National. Heidi, do you have another question you wanted to ask?
I'm trying to establish if the 26 you're talking about today are different from the ones, in Ontario and Quebec that we learned about yesterday and the day before. Is that in addition to those ones, or do those encompass those ones?
There are a total of 27 individuals who were on flights and have been determined either by the notification we received from our European counterparts or by a risk assessment in Canada to be in that low-risk group because they were on a flight but not in close contact with the case on that flight. So 26 came from notification from our European counterparts, and then there was one additional that a local public health assessment moved them from high risk to low risk after finding where they were seated and was able to eliminate any interaction that person may have had with the case.
And one more to you, Nicole, if you want to go ahead.
Hi, thanks. Yeah, I understand there's a very large WHO meeting happening tomorrow. Dr. Reimer, will you be a part of that? And can you you spoke a little bit earlier about the importance of international cooperation, the World Health Organization in this. How important is it to go forward and have, I believe they're calling it an emergency meeting about hantavirus. So how important is this meeting that's happening tomorrow?
I think what we've learned, or maybe been reaffirmed from hantavirus, is the importance of international collaboration. We would not have been able to determine that we had individuals who had been on flights had it not been for other countries looking at their flight manifests and evaluating the situation and providing us that information in a timely way. So I'm very much looking forward to participating in the meeting in Geneva with my WHO counterparts to build on this experience, to be able to ensure that we continue to have collaborative efforts, because this is critical that we work together to protect the health of everyone across the globe. And so it was really reassuring that our counterparts are working hard and towards the same goals as us. And I look forward to having those opportunities to have conversations with the WHO, as well as other countries who will be at the meeting as well, on hantavirus, but also on many other topics where international partnership is critical, thinking about things like health promotion, thinking about other infectious diseases, other non-infectious diseases. There's many different topics where international collaboration benefits Canadians.
And just as a follow to that, I know, as you just said, the meeting itself is focused on hantavirus, but is this a time where we really need to be thinking about how we're collaborating international on other sort of emerging pathogens? And for instance, one expert I talked to talked about how, this happened with hantavirus, but because its spread is limited, this could have been much, much worse if this were, say, an avian flu outbreak, for instance.
So the meeting that I was speaking to earlier is the World Health Assembly, which is the annual meeting of the World Health Organization. And so it's an opportunity for myself, for the Minister of Health, the Deputy Minister, some other delegates from Canada to meet with our counterparts from other countries around the world. It originally was not intended to be a meeting about hantavirus, but I feel certain that that will be a major part of our discussions given the experience that we've all just had with this virus. So the meeting will cover many important topics. It won't be just about hantavirus, but that will be part of those discussions. And it's going to be important that Canada continue to build those partnerships so that if there is a new virus that does spread more easily, that we have well-established partnerships, well-established communication mechanisms, information sharing in place so that we can all protect each other around the globe.
I'll wrap with the final question. Why don't we already have all of those things, given what we came through in the COVID pandemic?
So I would say that we do have great partnerships. In what we can see is how quickly we got information from some of our counterparts. We have been meeting regularly with, the UK, the US, with other European countries during this hantavirus experience. So it's not to say that we don't already have great relationships, but that we need to be always continuing to build on that, to learn from every experience like this, because we can always do better. And there's always going to be opportunities for us to find new ways to improve our collaboration. There will be new technologies. There'll be new evidence to include. So these types of meetings should continue on a regular basis so that we can continue to improve the science, the communication, the collaboration, and learn from each experience so that next time we're even more prepared than we were the time before.
And with that, we are out of time for questions. I thank you very much. Thanks for everyone for being here today, and enjoy the rest of your day. Virus free.